And Dr. Zorba is here ready to take your calls, and we're going to go with Roberta from Janesville. Hi, Roberta.
Yes, my question involves the new booster that we're going to have soon. I would like to know, does the addition of the extra variants, will that make the side effects any worse than they have been with the other 4 shots?
Okay. Oh, I don't think so. I think the side effects, basically, any immunization you get, you may get side effects. The shingle shot, people often get a fever. They may get a little pain at the site. Tetanus shots always produce pain at the site in most people. Polio, when you injections usually don't bother people too much at all. And the COVID booster, influenza, you may get a fever, but I don't expect that any of the side effects will be worse than the other shots.
Okay, they've been increasing for me with the first 4 shots.
Me too, Roberta.
Yeah,
me too.
Same.
That's right. And you may get more. It means your immunization is up there. It means your booster, your body is making really good antibodies. That's really the important thing. And look, we've got on one side, we've got getting COVID and we may die, you know, before we had them. And then the other thing, we have boosters that may cause us side effects for a day or two, and you make your choice.
Yeah, absolutely.
Yep.
All right, let's go to Mary in Beloit. Hi, Mary. What's your question?
I'd like to know if this new booster they're talking about with the new variant, is that for people over 70 who've already had the 2 boosters already?
Absolutely. That's exact. It's for everybody. It's for everybody. If it's 2 months after you've had either your primary series or your booster, you know, the other booster, you can get the new booster. And it's basically for everybody. And it doesn't matter what your age is. For the Pfizer, it's 12 years of age and over. Right now for the Moderna, I believe it's for people 18 years of age.
And if you had a booster less than 2 months ago,
then you don't get
you're supposed to wait.
That's right. You have to wait.
You have to wait.
Okay.
Right.
All right. We have Luann from Oregon. Hi, Luann.
Hi.
What's your question?
Tomorrow I'm scheduled to get some steroid injections to my back, and I want to know how long I have to wait before I can receive the new booster shot.
You know, I'm not exactly sure. I'd have to look at the CDC guidelines. But generally, if you're getting a steroid shot, it depends on whether or not it's in, we'll say, in a disc or in an area of your back where it's not going to go into your body. Generally, the CDC has not said not to get the booster if you get the steroid shot. So the answer is, from what I read from the last CDC website, is even if you get a steroid shot, you can get your booster.
Okay, good to know. Let's go to Ellen in Stoughton. Hi, Ellen. What's your question?
Hi, I was wondering about the sugar, the artificial sugar and stuff, and my question is, what about sugar alcohol? Is that different than artificial? Because I think it's plant-based.
The answer for this particular study, they looked at things like NutraSweet, looked at Splenda and the others. But I think we can look at the fact that according to this, all of the artificial sweeteners may have a higher risk of stroke and heart attacks. And we don't know exactly how much that is. But of course, as we say, what if you're eating too much sugar? That has a higher risk in stroke and heart attacks. My thought is good plain water. We should start getting into fizzy water and stop sort of fooling ourselves either by drinking sugary drinks or artificial sweetener.
Okay.
All right. We have Barbara from Monroe. Hi, Barbara. What's your question?
Good afternoon. Thank you for taking my call. I just tested negative after a very brief few-day bout with COVID. I was already double boosted. I wondered, when can I get the new booster? How long should I wait?
I don't think the CDC has set any guidelines for that at all, and that means you can get the booster anytime you want to. If you feel good, and once again, follow the guidelines 2 months after your primary series or the previous booster, I would get the booster. Having COVID does not stop you from getting the booster. And in fact, if I got COVID, I would go and get the booster right away.
Perfect. Thank you much, doctor.
Once you're better.
Once you're better. Once you're better.
Don't add,
You've got to be better. Right, of course, once you're better.
You know, what is this, 2.5 years in, and COVID's still top of mind of most people.
It may be top of the mind for years from now because it caused so many deaths and because it was such a horrible, wretched disease. So I think people are still concerned about it for good reason.
And so we should be a little cautious this winter.
Absolutely. And also, when you're going to the grocery store and it's influenza season, why not wear your mask? I mean, think about it. That's what they did in Asia for many years. We should start doing that now, wearing a mask when we're outside, especially in the wintertime. I mean, we haven't had a bad flu season because we've all been masking up.
They're predicting a bad season this year.
Right. And the predictions may be true, it may not be true, but if we mask up, especially when we're in public like that, in the grocery store, in the Quick Trip, that may reduce our risk of getting COVID and getting influenza. influenza.
Get the flu shot as well.
Exactly.
Get shots all around.
Yeah.